The Division of Infectious Diseases is part of the Clinic of Hematology and Oncology. Related to patient treatment, there are 5 main fields. First, we treat our patients with infectious diseases at the ward. Second, we have a specialized outpatient clinic for patients with infectious diseases. Third, we also have a new infection control center, which was just initiated with the SARS-CoV-2 pandemics. Fourth, we have a large infectious disease consulting service, seeing a lot of inpatients with complex infectious diseases, more than 2,500 recommendations every year. Fifth, we have an independent antimicrobial stewardship team, also dealing a lot with education, resistance, and antibiotic consumption.
The Institute of Medical Microbiology, Immunology and Hygiene at the University Hospital Cologne is responsible for the laboratory diagnosis of infectious diseases caused by bacteria, fungi and parasites. In addition, the Institute performs hospital hygiene tests. And finally, the Institute provides a comprehensive bacteriological and chemical water analysis.
There's a broad cooperation with other departments and clinics in the university hospital to tighten the cooperations, and for a fantastic network there will be a Center of Infectious Diseases. This center will focus on best clinical treatment, best research, clinically research and basic research, and also education.
Moreover, interdisciplinary interaction with our colleagues at the University Hospital Cologne is of critical importance in order to treat patients suffering with infectious diseases. Of utmost importance for me is a close cooperation with the colleagues from clinical infectious diseases, virology, clinical chemistry, and the hospital hygiene. A key element of this interaction is our contribution in antibiotic stewardship teams and the contribution in interdisciplinary grant rounds. In these rounds, pre- and post-analytical steps can be discussed in order to improve patient-oriented diagnostics.
In the Division of Infectious Diseases, there's a broad expertise in research. This research is related to basic science, but also to clinical studies. And what is the main focus? The main focus is related to HIV, tuberculosis, mycology, and antibiotic development.
Research includes clinically oriented research topics and also basic research topics such as molecular host pathogen interaction and infection immunology. Our research aims to evaluate technologies to speed up diagnostics, to analyze adaptation of pathogens to their host, and finally, to identify novel targets for diagnostics and for therapeutic approaches. We will offer an overview of a microbiology diagnostics lab. For instance, we will provide in-depth insights of novel methods in diagnostics of outbreaks.
We will offer a broad insight into our activities. So these are activities in education, in clinical treatment, and in research. If the applicants wish, we can focus on their own field of interest, and we can also offer a small project.